Let's see about ectopic pregnancy. What is ectopic pregnancy? It is defined as a pregnancy in which the fertilized ovum develops at a site outside the uterine cavity. This is ectopic pregnancy, and the most common site for ectopic pregnancy is the fallopian tube, which accounts for about 95% of the cases of ectopic pregnancy. Now let's see the types of ectopic pregnancy. The types include tubal pregnancy, which is in fallopian tube. Next, pregnancy in a rudimentary horn of uterus. Next, abdominal pregnancy. The others include ovarian pregnancy and cervical pregnancy. The names are self-explanatory. So these are all the types of ectopic pregnancy. Now the incidence. One in 50 pregnancies is an ectopic pregnancy, out of which, as we have already seen, tubal pregnancy is most common. And there is something called as heterotropic pregnancy. The heterotropic pregnancy is one in which there is normal uterine pregnancy along with an extrauterine pregnancy. So normal pregnancy along with ectopic pregnancy is heterotrophic pregnancy, and this is more common with the use of assisted reproductive techniques in case of infertility. So this is the introduction and the types. Now let's see about the tubal pregnancy. So tubal pregnancy is nothing but pregnancy which occurs in the fallopian tubes. This can occur at various sites of fallopian tubes, which are interstitial, isthmic, ampullary or infundibular portion. So this is the uterus, and if this is the fallopian tube and this the ovary. The different sites of tubal pregnancy include, this is the interstitial pregnancy, or also called as cornual ectopic pregnancy. This is the isthmic part, which is the narrowest part. So this is isthmic. Then the other sites include, this being the ampulla, and here will be the fimbrial. This is the ampullary, this is the isthmic, interstitial, and the fimbrial infundibular. These are the four sites of tubal pregnancy. Coming to the risk factors. The risk factors for tubal pregnancy include congenital anomalies of the fallopian tube, or previous fallopian tube surgeries like the surgeries done for sterilization or tuboplasty, or if there is prior pelvic inflammatory disease like subacute salpingitis, which favors tubal pregnancy. So, this is because if there is subacute salpingitis, there will be destruction of the cilia present in the epithelium of the fallopian tubes, and there will also be peritubal adhesions. So, all these causes kinking of the tubes and narrowing of the lumen. Next is use of intrauterine contraceptive devices. Progestogen contraceptives. This is because they decrease the tubal motility. So, the fertilized ovum gets implanted in the fallopian tubes itself. And artificial reproductive techniques, which are becoming more popular nowadays, is the most important risk factor for ectopic pregnancy. And another important thing is previous tubal pregnancy, previous history. So, these are all the risk factors. Now, coming to the termination of tubal pregnancy. The interstitial pregnancy. The method of termination would be either abortion or rupture. So, the rupture can sometimes lead to secondary abdominal pregnancy if it ruptures into the abdominal cavity, or it can also lead to tubouterine pregnancy, a part of which is present in tubes and the part is present in uterus, so it forms tubouterine pregnancy. Next is ischemic pregnancy. The method of termination would be rupture, which occurs at an earlier stage because isthmus is the narrowest part of the fallopian tube, at around 6 to 10 weeks. And there can also be extratubal rupture or peritoneal rupture. And there can be severe intraperitoneal hemorrhage. Sometimes this tubal rupture may lead to broad ligament. The tubal rupture which occurs can lead to broad ligament hematoma. Next is the ampullary pregnancy. The method of termination would be tubal abortion. This is the most common method of termination, or it could turn into a tubal mole due to intratubal rupture, or it can rupture into the peritoneum, which is intraperitoneal rupture. There will be profuse hemorrhage which can lead on to shock in these cases. Next is infundibular pregnancy. The method of termination would be abortion or as an interstitial pregnancy. There could be tubo-abdominal pregnancy. In interstitial there could be tubouterine pregnancy, whereas here in infundibular there can be tubo-abdominal pregnancy, partly in the tubes and partly in the abdominal cavity. So, this is all about the definition, types, and about the termination of ectopic gestation. We will see the remaining, that is the clinical features, investigations and treatment, that is management, in our next video. Thank you.